Hello and welcome back to another episode of the Digital Health and Wearables series. I've got another fantastic leader for you today, and if you have not subscribed, please do so and share the channel with all your communities in healthcare. And also let me acknowledge our global partner and sponsor, Spirit Digital. Check out the Digital Health platform. But I'm very excited today to have Corbin Petro. She is the CEO and also co-founder of Eleanor Health. Corbin, how are you?
I'm great, Joao. How are you?
I'm doing well. Nice to connect.
Yeah, great to be here. Thanks for having this platform and for welcoming me.
Thank you so much for your time. I believe, of course, we both in healthcare and share some similar connections and interests, and I'm going to go straight to the questions. Okay.
Sounds good.
So, what impact has COVID, the pandemic, had on the digital health landscape? What changes have you noticed?
Well, so Eleanor Health and my work is in the mental health and substance use disorder space. And like other aspects of healthcare, I think the biggest thing that we've seen, obviously, is the rapid adoption of virtual care. So for our patient population, we went from about 10% virtual care prior to the pandemic to quickly, over a matter of days, about 90% of our care being delivered virtually. And that shift to virtual care, I think, has really enhanced and increased the pace of adoption. So even as we go back to pre-COVID sort of comfort around meeting people in person and having in-person intervention, now people have been exposed to virtual care. And I think, as long as we get the partners, all the stakeholders involved on board with virtual care, a lot of that adoption will continue. So the move to virtual care requires adoption from patients, from providers, from regulators and legislators who say whether or not, in our space anyway, whether or not you can bill for services in person or virtually. And then, of course, payers willing to pay for it. And so you sort of need all four parties on board to continue this rapid adoption. And I think at least what the pandemic has done is introduce people to a technology and a way of interacting with one another in the healthcare space that previously wasn't sort of part of the go-to intervention. So I think that has done a lot. Obviously, the pandemic has introduced virtual care. That's been a big introduction. I think, broadly that has then increased investment in the space, had people thinking about other ways to leverage digital health from asynchronous interactions, as well as continued movement along that continuum of virtual care.
Oh, brilliant. Thank you so much for sharing that. Actually, I do agree with you. The pandemic gave us all a bit of a push to deliver care differently in a virtual way, more pragmatic way, and also, yeah, technology plays a big role in there. And it was one of the positive, if we can say, from the COVID pandemic. Thank you for that. Moving on to the second question: how can digital health benefit from value-based healthcare, and what do we need to consider?
Absolutely. So one of my favorite topics is value-based care. So it's thinking in the U.S. in particular how we pay for healthcare and how paying for quality over the quantity of specific services, which we do in a fee-for-service environment, leads to better outcomes. When we're focused on outcomes and preventive care and really talking about health over acute health care and paying for that in a value-based framework, how it can change what we do within the healthcare ecosystem and how we deliver care. So the great thing about value-based care, when done right, when structured in a way that really focuses on, whole person outcomes, the total cost of care and the spending that we have for each individual person, the more flexible we can be in what we deliver and how we deliver care. And so if we know that we'll get paid and we'll get very good outcomes for no matter how we deliver that care, it really opens the door to thinking about digital health and digital components, whether that's, remote patient monitoring and wearables, whether that's, a virtual visit versus an in-person visit, asynchronous interactions, platforms that patients can engage. If we know that we're really focused on the whole person, through a value-based framework of payment, we can use all these interventions in a way that's has a positive ROI and that's cost effective. Whereas in a fee-for-service environment, when we know we're only paid based on certain types of interventions and certain types of interactions, it doesn't incentivize that type of innovation and utilization of digital health. So value-based care, I think, is the biggest boon to digital health that we have. And so, I think the continued movement toward value-based care is just a strong driver of continued advancements and innovation in digital health.
That's for sure. And also value-based healthcare, as you described, it gives us an opportunity to truly personalize, gather for different needs, the different times for different individuals, instead of kind of delivering care as a set fee or a set standards or services for everybody. So yeah, is the future, and is a very hot topic, and I mean everybody's kind of adjusting and figure out how to deliver better outcomes and involve the patients in a better way. Thank you for that.
Right.
And moving on.
Well, just if I can comment on that quickly, I think, personalized medicine, thinking both from the right care, right time, right place for people, but also what that means from a health equity perspective, right? So when we're designing healthcare around everyone being equal, that's not right. People have different needs based on, their health literacy and health equity. And so value-based care allows you to deliver that more personalized approach across different socioeconomic classes as well.
Yeah, brilliant. Thank you. Moving on to the third and last question. You are Eleanor Health innovating around data and analytics, and how are you using them in order to improve how care is delivered?
Absolutely. So again, Eleanor Health is in the mental health and substance use disorder space, a part of the healthcare ecosystem that has been lacking data for a long period of time. So, historically in our space, there's a lot of psychometrically validated scales and screeners that have been proven out through academic literature and research, and they're just not used in practice. And so the first thing that we do is obviously we leverage evidence-based principles in the care that we're delivered, and we capture data at every intervention with our community members, which is what we call our patients. And so we do that by just leveraging the evidence base that's out there, the types of scales and screeners, and making sure that we're systematically capturing that data at the point of care. So we use things like the PHQ-9, the GAD-7. We use Recovery Capital, which is a 35-point psychometrically validated scale that evaluates a person's continuum on their recovery journey and their improvements across various social determinants. So we use that as a basis of our care planning and our models. So we leverage that data both at the population level as well as at the point of care. So for every intervention that we collect with our community members, we then can look at it at a macro level and say, where are we missing the boat when it comes to improving financial literacy, improving housing, improving retaining someone in their recovery, and we can identify how we can do things better. And then at the point of care, we use it as a mechanism to see how somebody's continuum of care is progressing. So we use that, but we also integrate that data into claims data and other third-party data sources that we get from our payer partners and other partners to really get that whole person approach. And we use that prior to an intervention with Eleanor. So we do predictive models to outreach and engage with patients who could benefit from our care model, and we use data in that way. So we're using it to engage the right people in care and then deliver better care once they're in our care at Eleanor.
Oh, fantastic. Thank you, Corbin. Fantastic work around mental health and also the substance misuse piece and the combination, because one goes hand in hand, isn't it?
Oh, absolutely. Well, addiction and substance use disorder is a mental health condition, but about 80% of people who have a substance use disorder have another mental health condition. And we, of course, address that within our care model. Critically important to do so. So yes, goes hand in hand, also goes hand in hand with other physical health comorbidities. So, often we find this in healthcare that people are complex. They often have multiple comorbidities. And so treating them within a holistic sort of whole person approach is often much more cost effective and successful than siloing those pieces out.
Fantastic. Corbin, we could talk much longer and explore much more. We come to the end of the episode. I finish all my episodes in a peculiar way. It's not really a question as such. Is what I call 1 minute of fame. So over to you. You can talk about anything from Eleanor Health to uh, personal things, family achievements, a shout out to anything. So over to you to round up 1 minute of fame.
Well, I didn't know this was coming, so I didn't prepare my 1 minute of fame. So I'm not great to talk about myself. So I'll talk about Eleanor Health and all that we're doing. I think we're at this precipice in society at large where we are really, and I think COVID has helped this as well, starting to address mental health without stigma, starting to recognize that everyone around us, whether it's a professional athlete, whether it's the most successful people around us, are impacted by their own mental health challenges and struggles. And that varies a lot. And so the stigma that we've had in our society around mental health, around substance use disorder, I'm hoping will soon be a thing of the past, where people feel comfortable talking about their challenges and people feel comfortable seeking help for those challenges, so that we can live the most fulfilling lives that we can and give back to society and future generations. So really that's all I would say. Is I think we're in such a promising time, and look forward to all the insights that you bring as well, João.
Fantastic. What a way to finish. And as you mentioned, extremely important, the discussion and also the openness about talking about mental health. Corbin, we come to the end of the show. Thank you so much for your time, for your expertise, for your insights, and for your input. And nice to see you. Thank you so much.
Thank you. Thanks for having me.
I'm going to round up now. Thank you for all the listeners and our viewers. Make sure you subscribe, share this channel with everyone. I want to acknowledge our global partner in Spirit Digital and all our other partners. And I'm going to put the links to connect with Corbin at Eleanor Health, connect with her, ask her things about the great work that they are doing. And I'll see you all next week.